Hi, Dr. Epstein.
Hi, Carrie.
So it's Tuesdays with the doc.
Yes, it is.
And you are about to go in to do a surgery, and it's a facial rejuvenation surgery. What are you going to do?
Well, in this particular operation, I'm going to be performing a facelift, an upper and lower eyelid blepharoplasty. Some people call it an eyelid lift. So I'll be doing those two procedures on this patient to give her or rejuvenate her face.
And why did you choose those particular procedures for this patient?
Well, they were the appropriate thing to do for her. When a patient comes in for a consultation, I'm evaluating their particular issues. What are the aspects of their physical exam that gives them an aged appearance? Of course, I'm also taking into account, what are some of the issues that actually bother the patient. They may come in with, a very specific type of complaint. Like maybe, even though their entire face is aging, their only problem seems to be, what they see around their eyes. And so we may focus the rejuvenation specifically just to that aspect or just that area in the face. So in this particular patient, she has pretty good skin, so I felt like skin resurfacing wasn't going to be an appropriate treatment for her. And in terms of volume, which is another particular issue that can age the face, because as we age, we lose volume in the face. That wasn't really a part of her problem. It was simply the things that are related to gravity, and that's what we're treating.
Some patients ask us, is there a smaller type of a facelift that they can have done versus having like a full facelift?
Okay, well, of course, as I kind of said, every face presents a little bit differently, and of course, when somebody on the younger side of facial aging, and when they're in their 40s and 50s, they're going to present with a different set of problems than somebody that would come in that were in their 60s and 70s. And of course, there are some other ways that facial aging can be either sped up or slowed down depending on genetics as well. So the first thing, as I said from the very beginning, it's really important that I have this evaluation, explain to them what their problems are. If the patient doesn't need a facelift, we don't do a facelift. And also sometimes there are mini facelifts, or we call them in our practice rejuvenation facelifts, where they're much smaller incisions. And then there are procedures that are even less invasive. I'm doing a procedure called skin tight on many patients now, which is using a process called RFAL, and it's radio frequency assisted liposuction. And actually the liposuction part of it is hardly ever used, but we're using the liposuction cannula and radio frequency simultaneously to get skin tightening. And this can be done through a tiny little incision that you don't even see after it heals. And so that's kind of exciting. That's what's kind of, those types of procedures are what's kind of on the forefront now. And if we catch the patients earlier, we can probably delay the need for a full facelift.
So you can do the Lipo RF on the face and the body? Is that correct?
You can. Actually, there are certain parts of the body that will respond as well, like on arms. I've done several arms now that are sagging a little bit, but they're not quite bad enough to warrant doing a full brachioplasty where we're excising skin in the arms, and I'm presenting this as an option, and the patients are seeing nice results.
And on the face, where would you do the Lipo RF?
Well, again, it varies, right? So it depends on what they're complaining about and what their actual problem is, and it's the combination of those two things. So if in fact they have sagging in the midface, I may just be doing the RFAL or skin tight procedure, in the upper face here. So as the contraction occurs, it'll create lift. Other times I may be doing the lower jawline and neck area to sharpen the jawline and lift the neck at the same time. And I'm seeing some stunning results, particularly along the jawline and the neck with this procedure.
Okay, great. Thank you, Dr. Epstein.
Great. Thanks for asking.